that never, going to a private school, conservatory music became my possibility. And just 10 years after my graduation from there, I was awarded the Young Outstanding Alumni, and I can't think of a university that I represent with more pride and more gratitude than UOP. But another never, that didn't come out to be true. I did get my degree in music therapy, and I'm extremely grateful for it. Just so you know, those of you who don't know what a music therapy board certified, we have to get a bachelor's, master's, or PhD in music therapy. You must then complete a 6-month internship. That's 1,041 hours. That's 6 months full time in an accredited clinical site. After you finish that, you have to sit and pass a board exam. If you don't pass it, you can take it again. When you pass the board exam, then you have to keep up CEUs. That's 100 minimum CEUs that you have to keep up. It means that you have this professional requirement. Once you get that MTBC, it's recognized at the federal and at the state level as you're licensed to practice music therapy, and that comes with a lot of responsibility. That comes with, if you know what peer review is, your peers can pull that license at any time. A doctor can report you a patient. Anybody can pull that license to practice. There's code of ethics, there's clinical standards, and you must meet those standards, and you must constantly work to keep your professional training up. And in music therapy, again, we're musicians and artists trained to perform in clinics. We learn the medical culture. You have to know your music, but you must know how to work in a medical. You have to talk to the doctors, work with your treatment team, know all the things that have nothing to do with music to save that person's life. So we are musicians, but it's a different performance. Some of the stories that I can tell you when we were students, and to kind of really get you to understand the difference that you're moving out of just the music culture only into another culture. You're put from day one into clinical practica with experienced music therapists. We were at St. Joseph Medical Center, at the public schools and geriatric psych facilities, just all over the place. The experience that happened to us while my class was going through school was a gunman opening up fire on a playground. Jim Linderman, the head music therapist, all the interns, all the students, you were part of that trauma. Right away you found out what gunshot wounds look in children and the trauma of the parents, and it made you quickly realize the level and the type of performance, the music requirement to help with that clinical team to save those lives in a very traumatic situation, and how to handle yourself and everybody else on that. Those are the kind of things you immediately realize this is very different than stage performance and then the regular. It's very divergent. So we're going to use music again for educational, medical, neurologic, social, emotional outcomes. It's not about performing the music. So with all of that as my background, as you know, in school, I was very determined, even in college. It's all about my center that I wanted. I took extra government relations and business courses. I was ready to launch out the door and do that, so I did. And I did it here in Austin, Texas in 1990. 23 years. We're the first for-profit music therapy company in the world. We're not only in Austin Regional, but in the world. I chose for-profit. There was only one other music therapy center in the world beside us, and it was non-profit. It's called the Nordhoff Robbins Center, and if you've ever seen it in London, and now there's one in New York, it does one technique, and it's all about the music. It improvises. It's amazing, but it's only with developmentally disabled children and adults, or it was at that time. There's no outcomes, so there's no working with burn patients where you compose the music and help them through burn or through cancer. Like I said, the trauma of wounds, the neurologic things that you're going to see, there's not the diversity that I wanted. There's also, it was so dependent. I noticed that it had to be about one thing if you do for-profit. People want you to declare, I'm just about Parkinson's, I'm just about children, I'm just about neonatal intensive care. Also, my drive since I was 12 years old, you're going to hear, I wanted one that was driven by the patients, by the client's needs, and the for-profit model enables me to do that, enables me to respond directly to the patient's needs, create whatever financial model I need to respond and get that help to them faster than what is required with grants and research and other things that come with nonprofits. So that's why it's so important to me to stay for profit. We basically make what we spend what we make. We're for profit for the community good. Historically, I have Dr. Weigel here, and I'm thrilled. We've worked since the 90s. We were all over the state. My company had 21 full-time music therapists all over the state. Houston, Corpus Christi, Dallas, should I say Rockport? Just everywhere. We were all over. We were working partial psych, partial hospital programs, other psych. We were working with Memorial Hermann, Santa Rosa in Houston, Santa Rosa Hospital, St. David's here, Brown schools down south, charters, CPCs, clinics, schools, pain management, all over the place. I was the first music therapist to get music therapy reimbursed by Medicare, Texas Workman's Comp, Travelers, Blue Cross Blue Shields, pushing Medicare, helping support the Medicare Part B. That was a big breakthrough for our field. I published books. We created tapes and CDs back then. We had internships here we don't currently, and we trained music therapists. And even if you guys know Mia at TIER, she trained here with us and was one of those young performers who first hit the wall in the first couple weeks. I can't do this, I'm not meant to be a music therapist. And with training and help, Mia's gone on to work at TIER, and she's just been on the media a lot. She's the music therapist that helped Gabby Gifford speak and walk again. So we have a long history, in many ways impacting not only us in the state, and of course you're going to hear about how we've had international and national impact. But today, the Center for Music Therapy continues to lead with cutting-edge models based on a responsiveness to the client's needs and our mission to provide access. Our Health First Song program, which if you're here and you know us as clinicians, it's a program that is very forward-thinking and a very forward-thinking clinical model with a sustainable financial model. And we're using a low monthly fee structure designed to allow people sustainable access to therapists and services. We have moved our focus of care from hospitals and inpatient to outpatient into the community, like you see here. We're taking the next steps of community access by launching our YouTube channels next month. Our programs are creating new options and ways to discover new potentials for real individuals. We've been nationally and internationally recognized for our work with neurologic music therapy. Our work is featured prime time, CBS, 48 Hours with Dan Rather. Our patients are finding ways of changing the conditions here. They're finding ways to change the conditions which they're pursuing their recovery. Health First Song provides the financial model and clinical support to make this all possible. I tell my clients the best of information is just information. Your potential in life is as open to new possibilities as the human spirit is capable of achieving. And with children, I impress us even more. I see child after child, year after year, prove this to be true. The earlier we start changing the environment, the sooner a different expectation can be achieved. So access to therapy is a big piece of the battle to make that change possible. We draw, here at the Center for Music Therapy, we draw people nationally and internationally to our workshops. We're also unique. We're an alcohol-free, healthy living live music venue. And we're one of the few in Austin. This is a private event, so we serve the alcohol, but when we're open to the public, no alcohol. So as you've heard about our history in these 23 years, we have an extremely diverse level of experience and unique. So people seek us out to consult for advice on topics, products, projects. They ask me to speak, and that's why I speak nationally, internationally. I don't do many home gigs like this. But one of the most special things is here in the center, and I hope you guys will take a chance after we're done to take tours and find out what's unique about how we built this out. Because if you're here tonight, it means that you're somebody I or my staff respect and trust. I have one of the best teams ever assembled in the history of this company. And we demand real love for the work we all do in order to be a part of this team. Our clients are committed to seeking solutions. They seek real help for the diseases, disabilities, challenge they face daily. And we work beside them, battling disease, battling disability, and even death. This company is truly rare, a healing force in Austin, and a treasure within the live music capital of the world. The purpose of the Inspired Hope Project and the Songs of Strength is to enable the Austin community to stand with us in support, to see us into our 24th year and beyond. Letting our legacy be known through the power of arts, together lifting our voices in songs of strength. When I talk about the uniqueness, you're not going to easily find, one, a music therapy center, two, one that does full spectrum of music therapy. Like I mentioned, we do neurologic, we do psychological, we do child development, we do adult development, we do pain, we do cancer. We do a lot, and that's a full range of diagnoses and conditions, mainly because it's not easy to find a music therapist. We do birth to grave, as you heard Dorothy's story, and you're going to hear a lot of our recognized birth programs, birthing and NICU programs. And as I've already said, a full range of interventions, most of them cutting edge. So these are some of the faces you see here today. And the rest of the presentation, I'm going to actually talk about my favorite thing, is stories of our clients who inspire me so much. And so you're going to see faces of children, parents who are told the information they need to hear, and they need to have, and they deserve the best information, good research, and good clinical experience.